What's up everyone? My name is Dr. Mohammad Abou and I'm here today with you with a new video for clinical scenarios. So let's watch. Today we're gonna talk about a clinical case that usually occurs during the winter. We're gonna talk about Raynaud's disease. The symptoms of this disease are probably so clear. You see, if you are sick and you have this disease and the weather is cold and you're feeling so cold, you're gonna notice that your fingers or your toes are starting to turn into white color, and soon enough they would become blue and they would become so painful. Now, Raynaud's disease have two kinds. There are primary Raynaud's disease and a secondary type. For the primary type, the seizures of this type are usually so simple and they are not that much severe and they won't push you to see a doctor. That's for sure. So this kind of disease is usually curable by itself. Otherwise, the secondary type of Raynaud's disease, and when I say secondary type, I should say and refer to it by saying Raynaud's phenomena. So whenever I say Raynaud's phenomena, you have to understand that we are talking about the second kind of Raynaud's disease. Now, Raynaud's phenomena is probably a reflection of another important disease occurring during our body, like if we have a problem within the connective tissue or during the arteries of our body. Or it might be a carpal tunnel syndrome. And if Raynaud's phenomena is a reflection of an artery disease, then probably this artery disease would be one of three main kinds. It might be an Atherosclerosis or Buerger's disease or primary pulmonary hypertension. So if we're going to talk about the differential diagnosis, as we have already said, this Raynaud's phenomena is probably a reflection of another problem during our body, whether it's a connective tissue problem or an autoimmune disease or even a problem within the arteries of our bodies. So a doctor would probably do a test called nail-fold capillaroscopy, where the doctor is going to examine the base of your fingernail under a microscope or a magnifier in order to find any deformities within the artery. The doctor might also do a test called anti-nuclear antibodies test. If it's positive, then we have probably an autoimmune disease or connective tissue disease. And another kind of test the doctor might do is called an erythrocyte sedimentation. So if the sedimentation of the red cells is much more than the normal rate, then this indicates that we might have an inflammatory disease or an autoimmune disease. If we're going to talk about the prevention of Raynaud's disease, then the prevention comes from its causes. As we all know, the Raynaud's disease is triggered by the cold weather. So in order to prevent its seizures, we have to wear warm clothes and to maintain the warmth of our body. So what about treatment? Okay, there's two kinds of treatments. You either treat this kind of disease by drugs or you treat it surgically. Now, if we're going to talk about the treatment with drugs, we're gonna name two main drugs within the treatment process. These two main drugs are calcium channel blockers and vasodilators. These two drugs works on keeping the capillaries of your hand and your feet open wide and prevents them from being blocked. And if we are going to talk about the surgical treatment, then first you should know that there are kind of nerves called sympathetic nerves. Now, this kind of nerves is found during your inside your hand and in your feet, and the job of these nerves is to control the extraction and contraction of your capillaries. So if we have practically managed to cut these nerves from your hand and your feet, this will prevent the severity of the seizures of Raynaud's disease. And by that, my friends, we have reached to the end of our episode. I hope that it was helpful and useful, and I would like if you tell me, my friends, your opinions through the comments. And don't forget, like and subscribe to keep up to date with our episodes. Thank you for watching.